Today's webinar is entitled Inside the NSSRN, History, Recent Findings, and Research Applications. And this is sponsored by HW Tech, the Health Workforce Technical Assistance Center, and co-presented by the Health Resources and Services Administration, otherwise known as HRSA. I just want to go through a few things. My name's Leanne Keogh. I'm the Communications Director at the Center for Health Workforce Studies at the University at Albany, and also for the Health Workforce Technical Assistance Center here that is hosting this event today. Um, and I will be your moderator for today's event. Let me tell you a little bit about HW Tech first before I get started. So, HW Tech is based at the Center for Health Workforce Studies at the University of Albany. And we provide technical assistance to states and organizations that are involved in health workforce planning. And that's, to provide them with our knowledge. We've been doing health workforce research for over 30 years as an organization. So HW Tech's role is to provide that expert knowledge and assistance with data collection, analysis, and dissemination. And so we encourage people, our participants today, to take a look at our website, and that's at healthworkforceta.org. We have a really extensive library. We do these webinar events mostly at least once a month, sometimes more. And so at this point, since we've been operating with HW Tech for over 12 years now, we have quite an extensive library of videos of these events. As I said, they're recorded and shared on our website afterwards. But in addition to videos, we also have reports, research briefs, and different resources. We have a data collection inventory where people can see sample surveys of what different states are doing as far as data collection for health workforce goes. So a lot of people find that helpful. And then also at the bottom of our website, you can subscribe to our mailing list, and that will allow you to receive notifications when resources are posted to our website, when new research comes out. And also we disseminate the work of all 9 federally funded, HRSA funded, which is our presenters today. All of those health workforce research centers across the country. There's 9 of them, so we share all of that research as well. So I encourage you to go ahead, sign up so that you can be on top of the latest research as it becomes available. As I said, I'm your moderator today. Already introduced myself. So I'm going to go ahead and introduce our presenters. So first we have David Armstrong, who is Director of the Health Workforce Technical Assistance Center here at HW Tech. And then from HRSA, we have 2 presenters here joining us today. First is Stephen Wilbur, PhD. He's an economist at the National Center for Health Workforce Analysis, or NCHWA, which is part of the Bureau of Health Workforce at the Health Resources and Services Administration, which is part of the U.S. Department of Health and Human Services. And also joining us from HRSA is Helen Van Yu, and she is a statistician also from HRSA at the Center for Health Workforce Analysis.
So we're going to talk a little bit today about the National Sample Survey of Registered Nurses, and we thought it would make sense to start with some background and some sort of high-level numbers from the prior survey. So the NSSRN is the longest-running survey of registered nurses in the United States. It's been conducted since 1977, and it provides educators, health workforce leaders, and policymakers with important details and developments on the nursing workforce. We partner with the Census Bureau to administer the survey. It's conducted every 4 years, and the 2026 survey is currently out in the field for collection. There were approximately 125,000 nurses that were sampled for the 2026 survey, and the survey is going to collect data from registered nurses as well as advanced practice registered nurses. The survey collects a wide range of data, including demographics, educational attainment, that would be such things as initial nursing degrees, highest nursing degrees, and any non-nursing degrees. Collects data on licenses and certifications, including whether or not a nurse is certified as an APRN, and it also collects information about skill-based certifications. The survey collects data on employment characteristics and work environment, such things as employment setting, clinical specialties, telehealth usage, retirement plans, wages and hours. And we also have data on burnout and job satisfaction, as well as many other variables of interest. So as I said, we thought we'd start with just providing some key findings from the 2022 NSSRN and go through some of the data there. So as of December 31st, 2021, there were more than 4.3 million licensed RNs in the United States, and nearly 3.5 million of those were employed as RNs. There more than 343,500 RNs were employed as advanced practice RNs, with the majority of those, about 266,000, employed as NPs. 182,000 RNs were employed as travel nurses, which was about 5.3% of all employed RNs in the 2022 survey. And this was a considerable increase over the numbers from the 2018 survey. And one very interesting number that we're going to be looking at in the 2026 survey is how this number of travel nurses has changed over time. Next, we want to look a little bit at the workforce size and composition. We talked a little bit before about the number of actively licensed nurses, but what the results for 2022 showed us was that the size of the nursing workforce had increased a fair amount over the 2018 survey. The number of licensed RNs increased by nearly 10%, while the number of licensed NPs had increased by more than 100,000, which was about a 40% increase. The workforce has also become more diverse. While 88% of all RNs are women, the share of RNs that were men grew from 9.6% to 12% between the 2018 and 2022 surveys. And then the share of RNs that were non-Hispanic white also declined from about 73.3% to 67.1%. So as you know, RNs can enter the workforce through a variety of educational pathways, and very often they have prior experience with health-related jobs. In the 2022 survey, a bachelor's degree was the most common degree for the initial U.S. licensing, with nearly 2 million RNs, or 45% of the workforce, and indicating that they had entered the workforce with a bachelor's degree. But nurses usually and often go on to get higher degrees or certifications. In fact, 40.2%, or nearly 1.8 million nurses, have completed a second degree or an advanced certification. In fact, more than 825,000 nurses have either a master's degree or a doctorate degree as their highest nursing degree. So nurses use a variety of methods to finance their education. But what we found in the 2022 survey was that 2.2 million RNs, more than half of the workforce, had borrowed money to finance their degree, and that as of December 31st, 2021, RNs had approximately 48 billion in outstanding student loan debt. In terms of job satisfaction, the majority of RNs have indicated that they're either moderately or extremely satisfied with their current nursing position. However, the share that expressed some degree of dissatisfaction nearly doubled from 11 to 19.9% between the 2018 and 2022 surveys. And if we look at this by clinical specialty, we notice that that job satisfaction declined in 20 out of 21 clinical specialties that we looked at. So along with lower job satisfaction, nurses have reported a higher level of burnout. And in fact, burnout and a stressful work environment were among the most common reasons given for leaving the workforce in the 2022 survey. So about 2.2 million RNs, or 82% of those employed in the same position for at least a year, have indicated that they experienced burnout at some point in their career. And the majority of these nurses that experienced burnout indicated that the feelings of burnout had increased. The share of RNs that felt burnout every day more than doubled from 11.8% in 2019 to 25.7% in 2021. So going back to the reasons for leaving their nursing position, burnout was the second most cited reason behind retirement. But other reasons that people left their primary nursing position included a stressful work environment, inadequate staffing, lack of good management or leadership, as well as family caregiving and other factors. So where can you find more information about the NSSRN? So the majority of the data that we collect on the NSSRN is publicly available through our public use files, which can be downloaded from HRSA's data warehouse. We have also developed a data dashboard, the nursing workforce dashboard, that has more than 400,000 data points. There are tables and visualizations in the dashboard that provide the key results and details at both the national and state level for various types of nurses or various licenses. The dashboard also includes data from both the 2018 and the 2022 NSSRN. We also have more information about the NSSRN, along with some data briefs and other research on our website, our NSSRN webpage on the NICWA website. So I'm going to stop here and hand off to David, who's going to present his results from a study that he did using the NSSRN.
All right. Thank you, Stephen. Well, once more, thank you, Lan, for kicking us off today. And thank you, Stephen, for the introduction there, the presentation regarding the NSSRN. And also, one other thing I'll point out to you, after my presentation, we're going to go into a Q&A session. But following that, with about 10 minutes left, we're going to jump back on and let HRSA tell us a little bit about the current NSSRN survey, which is in the field. Okay, my presentation is called Exploring the Wage Disparity Between Nursing Faculty and Clinical Nurses. And this is really just an example of a research application of the NSSRN. Now, I think Lan's already covered who we are, but once more, I'll remind you, if you haven't already, by all means, check us out on our website at healthworkforceta.org. Now, a little bit of a background on this study. Nursing education programs face persistent difficulties in the recruitment and retention of qualified faculty. And a recent study found even that almost 60% of nursing education programs in the U.S. had a full-time faculty vacancy during the 2024-2025 academic year. And of course, the most frequently cited barrier to attracting and retaining nursing faculty is low compensation. That is, nurses can make more in clinical settings than they can like training the next generation of nurses. And just kind of a little bit of background on this. One of the reasons why we decided to conduct this survey was because a few years back, I was trying to cite this. Anecdotally, we know that nursing faculty make less than their nursing counterparts in clinical settings. But there's really not a lot of good documentation out there. That is, no study to date has systematically documented these differences. I found um, one or two studies that had some numbers, but they're almost comparing apples and oranges, to be blunt. And so I just found them unsatisfactory as a site. And so the primary objective of this study is to analyze and compare salaries between nursing faculty and their counterparts in clinical practice positions, and of course in other roles as well. Now, surprise, surprise, we're utilizing data from the 2022 NSSRN. And we included nurses who were employed full-time as of December 2021, which after that, in some list-wise deletion of missing cases, we came up to about an N of 33,000. And nursing faculty in this study were identified as those who reported their job title as academic educator, professor, or instructor in a school of nursing. And the outcome variable, of course, was annual pre-tax earnings from respondents' primary nursing positions. And essentially the question, please estimate your 2021 pre-tax annual earnings from your primary nursing position, include overtime and bonuses, but exclude sign-on bonuses. And so what type of methods did we use for the study? Well, first, I'm going to present to you some 95% confidence intervals were calculated for annual earnings by job title. So we're going to look at that just straight up, how much people earn by job title. Then we're going to look at some descriptive statistics and chi-square tests. These were employed to examine differences in demographic and professional characteristics between nursing faculty and nurses in other roles. And finally, then we're going to do an OLS regression model. We're going to use this to compare annual servings while controlling for a number of factors. And we'll talk about that here in a second. But first, to kind of give you a little bit of background, let's talk about the distribution of full-time nursing positions in 2021 in the U.S. Well, there's an estimate of about 2.8 million full-time nurses employed in nursing positions in the U.S. during this time frame. And as you can see, most non-advanced practice registered nurses served as staff nurses. That is almost half of all nurses, 46%, or about 1.3 million full-time nurses were staff nurses. And this was followed by charge nurses, about 271,000, or about 9.5% of the total. So, we're already below 10% here. And of course, there's that other category in NPs as well. But I also want to point out frontline management. And frontline managers, they took up about 4.9% of the overall population of nurses, according to the sample survey. And I'm pointing out these three groups in particular, that is staff nurses, charge nurses, and frontline managers, because you can kind of imagine if a nursing faculty member decided to go back into clinical practice or decided to never leave clinical practice, these might be some of the positions they are in. That's assuming they're not NPs or CRNAs or some other APRN position. Now, as far as nursing faculty themselves, well, they make up a relatively small fraction of nurses in today's economy. That is, only about 45,000 nurses are nursing faculty, or about 1.6%, which seems relatively small, but also keep in mind, outside of staff nurses, all the other nursing positions fall under 10% as well. So what about their salary? Well, here we're looking at the annual income comparison, 95% confidence intervals. And of course, I have highlighted there nursing faculty. And on average, the main annual income for nursing faculty was about $81,000. Now let's compare that to other nurses. Once more, staff nurses earned an average of $83,000. Charge nurses earned about $87,000 annually, and frontline managers earned $98,000. Now, with that said, of these comparisons, only frontline managers are significantly greater, making significantly greater money than nursing faculty. But of course, there's other nurses titles here as well: middle management, senior management, CRNAs, etc. But This may not surprise you. Now let's talk about the demographic characteristics in like the professional characteristics of nursing faculty compared to other nurses. And of course, there's a lot of differences here. Other nurses, well, specifically nursing faculty are significantly more likely to be females and white non-Hispanics. To be more specific, about 92% of all nursing faculty are female, compared to 86% of their counterparts in other clinical and other roles. Also, about 74% or 3/4 are white non-Hispanic, compared to only 63% in other nursing positions. So those are interesting. But what's far more striking is their education levels and their experience. Probably not too surprising, though. After all, anecdotally, we do know that a lot of nursing faculty, they start out in clinical positions and only later on move over towards these faculty positions. But they are also far more likely, as a result, to have an MSN degree or higher, or have more than 21 years of experience. And so 89% of nursing faculty have an MSN degree, compared to only 19% of other nurses. And I say have an MSN degree. This also includes some doctorate degrees in there as well, MSN or higher. And also 59% of them have 21 or more years of experience. Comparatively speaking, other RNs, they only about 29% of them have more than 21 years of experience. And so we're looking at a population of nurses who are, well, tend to be more educated and have much more experience. And another demographic figure I could have thrown on here is age. Yes, they tend to be older. On average, they're about 52 years of age compared to 45 for other nurses. So now let's move on to the OLS regression model. Once more, the dependent variable, surprise, surprise, of course, is going to be annual earnings or annual income, however you want to describe it. And to go ahead and get at what we want to, we've entered a series of dummy variables into the equation. Were used to indicate nursing position, and nursing faculty was the reference category. So essentially, we're going to compare nursing faculty to staff nurses, frontline managers, and all the other categories you saw in one of the previous slides. But in doing so, we're also going to go ahead and control for a variety of factors, including sex, race, ethnicity, age, highest nursing degree, APRN status, work experience, employment setting, rural location, working in a HRSA, clinical specialty, marital and children status, census division of resident, and hours worked per year. And this last one is especially interesting because there's also this idea out there, and it's, I'm not saying it's untrue, that a lot of nursing faculty, one of the reasons why they might let less than their counterparts is they only work 9 months a year. Now, there is a month's work category within the NSSRN, but that had too many missing variables or missing cases for us to use it. But we were able to use hours worked per year as kind of a way to get at this issue. And oddly enough, I didn't show the actual statistic here or the descriptive statistic, but nursing faculty actually work a little bit more than their counterparts annually. So they actually work more hours per year than other nurses. And once more, there's about 33,000 in our sample here. So what are the results? Well, here's the results from our regression equation. And once more, the comparison category, the reference category here is nursing faculty. And pretty much all the other nursing positions except school nurse make significantly more than nursing faculty. So after adjusting for a range of factors, nursing faculty earn significantly less than their counterparts in other positions. And let's get back to those 3 categories we were talking about earlier. Nursing faculty earn $18,000 less after controlling for other factors than staff nurses, $19,000 less than charge nurses, and $27,000 less than frontline managers. So once you take into account these other factors, this gap widens in terms of their actual salary, the actual salary differences, that is. Now, there were additional significant factors within the regression equation as well. In fact, most of our control variables were also significant. That is sex, race, ethnicity, age, highest nursing degree, APRN status, work experience, employment setting, rural location, clinical specialty, census division resident, and hours worked per year. Perhaps somewhat interesting, the only two factors that weren't significant were marital and children status, as well as working in a HRSA. So there's that. But let's now delve a little bit deeper here. What is the impact of these professional characteristics on the income disparities? One of the things we pointed out at the beginning of this presentation said that nurse educators are, demographically and also professionally, they have a lot of different characteristics compared to their counterparts. And so while nurse educators earn significantly less than other nurses, this income gap becomes even more pronounced when their qualifications and experiences are considered. That is, nurse educators possess higher levels of education on average than their counterparts, and they also have more professional experience than their counterparts. And these, of course, are attributes that would typically command higher salaries in clinical roles. And so what we did next was we took the regression model and calculated some predictive scores. That is, we modeled a staff nurse as if they had the same qualifications and experience as a typical nurse educator. And so if you give a staff nurse like an MSN degree or higher, or 21 plus years of experience on average, what would it do to their predicted income? Well, it would increase from $83,000 to over $94,000, about a $10,000 increase. For charge nurse, it would go from $87,000 to $95,000, about an $8,000 increase. Now, frontline management's a little bit different. We don't really see as much of an increase there. It only goes up about like $5,000, but it could be potentially because they already have higher degrees of education to be into these positions as already. So regarding this study, we did do some robustness checks, and we also want to talk about some limitations. Well, first of all, we did a couple of alternative models where we excluded all APRNs from the analysis. And we also did another model where we measured full-time differently. For this particular analysis, the one I presented, we used a variable for the NSSRN, like full-time or part-time, et cetera. But we also modeled it using hours worked per week, like do you work 40 plus hours a week as an alternate full-time measure. And none of these robustness checks impacted the findings. That is, the findings were largely the same. But our study, of course, does also have some limitations. First of all, the information is self-reported. And I will point out that a couple of the job titles, I didn't really use these as comparisons, but if you look at the job titles of middle management and senior management, well, these job titles also include associate deans and deans respectively. So there's a little bit of an overlap there, because presumably associate deans and deans, they might still do a little teaching on the side as well. And another thing to consider is when you're looking at this as well is that the NSSRN does not include information on non-salary compensation or benefits such as health insurance, paid leave, retirement contributions, et cetera. And this is an area where working at a university or a nursing school, they might have more benefits than, say, if they work at a private hospital or something like that. So that's something we can't really take into account, which, might factor in a person's decision to work as a faculty beyond just like fulfillment and greater job satisfaction. All right. So what are the conclusions here? Well, this study highlights a significant income disparity between nursing faculty and clinical nurses. And this income disparity becomes more pronounced when factoring in the higher education levels and greater work experience of nursing faculty. And this compensation gap, of course, it presents a major barrier for nursing education programs, which continue to face challenges in filling faculty positions. Now, this work has been published. Jim Pang was the lead author on it with Sage Shirey and myself. It's published in Nurse Educator, like towards the end of last year. I think it came out in print earlier this year. And also, we did a podcast with Nurse Educator. Shout out to Marilyn, the editor of Nurse Educator, for arranging that for us. And finally, acknowledges this study was funded by HRSA. And finally, well, we're about to go to a Q&A, but if you have any questions later on, you want to get in touch with me, here I am, EP Armstrong at albany.edu. That said, I think we can probably go ahead and start our Q&A session, Leanne.
Okay. So the first question we have is for either Stephen or Helen. Um, for attendees who may be unfamiliar with NSSRN, what makes this survey different from other nursing workforce data sources?
Well, it is a comprehensive survey. I mean, we sample from across the entire United States. We also include a lot of specific information. Every question is imputed and weighted so that we get representative national level results as well as state level results. I don't know if Helen, if you had anything you want to add there.
No, I concur with what Stephen said. I think the only other thing I would say is that the NSSRN is the most nationally representative and comprehensive survey for not only registered nurses, but nurses also with advanced degrees as well. Um, so I would say that outside of other data sources, it's probably going to be your golden standard if you want something that is across all 50, all states within the continental US
Yeah,
and
that's a
nursing education levels.
yeah, that's a really good point. Came up in a different conversation I was having recently. On one hand, you can get a lot more granular data from like state surveys, re-registration surveys, et cetera. You know, they'll tell you, you might get a census of all the nurses in your state. But what you can't do with that is really benchmark yourself to other states unless they also have comparable data. So this is the one study that you can really do so. And of course, it's publicly available. So
Next question. Nearly half of nurses entered practice with bachelor's degrees, and how many pursued, and many of those pursued additional education. What does the NSSRN tell us about educational pathways into nursing today?
Well, we have a lot of data on that. So within the NSSRN, there's data on prior degrees earned. So you may have had, a non-nursing degree, and there's some information about what those degrees were, what the focus of those degrees were. And then there's a lot of information about prior health workforce experience. So a lot of RNs will have prior experience as LPNs. And I don't have exact numbers readily available, but within our dashboard, you can or within our data set, you can take a look at a lot of those things.
I'll also add to what Steven said that I highly, highly recommend everybody to use our public use files and especially take a look at the nursing workforce dashboard. There's a whole section there for the 2018 and the 2022 NSSRN on nursing education levels, and it'll actually show you a really nice visualization of where the initial degree was and what was the highest degree for the nurse, obviously aggregated. But if you download the public use file, it'll also provide you far more granular information about each of these nurses and the initial degree that they started with and the highest degree that they ended with.
And one very interesting find from the 2022 NSSRN was in 2018, the associate degree was actually the most common uh, degree for initial licensure. Um, and then that flipped to the bachelor degree, which tells us that the nursing workforce is becoming more educated. And that couples with the fact that many nurses go on for additional higher level degrees or certification.
Okay, we have some questions coming in from the audience. This first one is from Catherine Connell. What is your approach to continuing to make changes and revisions to the survey? Did you elicit feedback from nurses in direct clinical care?
So one of the things we did prior to the 2026 survey, as we were developing the survey document, is we did elicit feedback. It's hard to go to directly to clinical nurses, but what we did do was go to nursing associations, so American Nursing Association, American Association of Nurse Practitioners, and various other associations to get feedback on the forms and to have a general discussion on what were the important issues facing the nursing workforce so that we could make sure we were collecting the data that people need.
Okay. Another question from Kimberly Fox. How well does the survey support state level estimates, particularly in rural areas within smaller states?
So the survey data is available at the state level. We also do have a variable in there to indicate whether the nurse is located in a rural area. You do, depending on what you're doing with it, you can run into small sample sizes, which, of course, inflates standard errors and makes the, estimations less precise. But depending on what you're doing with it, you can get down to to the state level. We don't have in the public use file, we don't have any sub-state stuff other than you could split nurses into rural and non-rural.
Okay. Another question that came in, why did you stop providing county level data?
Uh, so as we began partnering, so this actually predates my time with HRSA. So, but my understanding is that it has a lot to do with sample sizes
Mm,
and wanting to protect confidentiality of the nurses.
okay, makes sense. Okay. This question is for David on the nursing faculty study. What are some potential strategies to address the pay disparity for nursing faculty?
Well, essentially, of course, you can just pay them more, but I guess that's not quite, the answer you're wanting there. But no, this is a systemic issue, and of course, it affects the entire pipeline of nurses. After all, you, there's persistent shortages of RNs and other nurses in the U.S., and you're basically not paying attention to the nursing faculty. You're basically shrinking that pipeline. Overall, you can only train so many nurses with so many faculty. That's
Right.
basically how it works. Now, of course, beyond simply increasing their salary, there's other ways to do this as well. As I pointed out during the presentation, and this is most nursing faculty have MSN or higher degrees. And that's partly because it's often required to have that level of education to be a nursing faculty. And so one thing you can do to make it more appealing for them to go into is to, have some scholarships for this extra training or some loan repayment programs, tuition support, etc. And so support nurses who are interested in becoming faculty by, give them a heads up on getting that like extra training they need.
Mm. Do you think there may be some strategies that are beyond financial, so beyond scholarships or just like as you were saying, just paying, increasing their salary?
Yeah, that'd be the best one. But no, uh, there actually is, obviously, there is. And I even mentioned it. One of the limitations in the NSSRN was we don't see what type of benefits packages they get in terms of like health insurance, days off, and all of these sorts of benefits. But there's also other tangible benefits that can benefit someone, such as like providing daycare, right? That's a
Mm,
big expense for people. So you can have some of these other programs built into your school, like providing daycare, which can really while it doesn't directly increase your salary, it really helps your overall income by limiting
Right,
that
because
expense.
daycare is
Yeah.
such a large expense,
Yep.
and so that may outweigh the lower salary if they don't have to pay
Yep.
for that. That
There's,
makes sense.
yeah, there's potentially a lot of hidden benefits they have beyond salary, which we're just not seeing here, in all
Mhm,
fairness.
mhm. So this one is back to either Stephen um, or Helen. And that is um, travel nursing increased dramatically between the survey cycles. Do you view this as a temporary post-pandemic phenomenon or a more permanent shift in the nursing labor market?
Um, I can take this one. I think we want to find out. That's actually a good question. We actually do want to find out if this is something that is symptomatic of what happened with the pandemic or if it's something that continues to be a trend. So this actually kind of goes into the teaser, the sneak peek for the 2026 NSSRN, where we would actually be expanding the 2026, we are expanding the 2026 NSSRN survey to having additional questions that focus on travel nurses so that we can better explore this phenomenon. So hopefully we will know more after the 2026 NSSRN data comes out.
Great. Yeah, I think that's a question for a lot of hospital systems, especially. I know they're still having um, travel nurses come in, and there can be some resentment there with staff nurses, and so there's a lot of issues around traveling nurses. So I think getting that kind of information would be very beneficial to help with planning.
Absolutely.
This one is for David. Um, should states and health systems view investments in nursing faculty as a workforce development strategy, similar to investments in clinical workforce recruitment?
Yes, and I think we make a pretty good case for that because it really isn't just an investment in nursing faculty, it's an investment in the overall pipeline,
Mm,
which impacts, hospitals, health systems, et cetera. They often have difficulty finding an adequate number of RNs, NPs, et cetera. And so an investment in nursing faculty allows more training of nurses, which, turns on that spigot more, if you will. And so, yes, I think it's a good investment because it impacts the whole healthcare system. I mean, nurses, they're by far amongst licensed professionals, they're by far the largest number of health professionals, licensed health professionals. And it's critical that we keep an adequate supply of them. So, yes, it's a good investment for the overall healthcare infrastructure. And of course, we know that healthcare, that's one of the biggest employers in the US.
mm. In your opinion, and this can go out to any of the three of you, in your opinion, how are researchers, states, and health systems most commonly using the NSSRN data to inform workforce policy and planning?
I can start. One of the things that we have noticed in HRSA is that one of the biggest questions we get regarding the NSSRN from data users is benchmarking. It is benchmarking their state's growth or their state's nursing workforce trends against national trends or against other states as well. And of course, there is the interest in looking at these trends for rural, non-rural areas. I think that's a big part of it. Yeah. I think some other questions that we've gotten, not necessarily from data users, but certainly when we were speaking with the nursing associations and other stakeholders for development of the 2026 NSSRN, is there's a lot of questions regarding retention for the nursing workforce, and what are some of the factors or some of the issues that are impacting or influencing job satisfaction, burnout, and overall retention. So I think that also dovetails into what David was talking today about. Salary certainly makes an impact, or it certainly influences the nursing workforce, but there are other factors that could also be influencing whether a nurse decides to continue to stay within the workforce and provide the care that he or she is providing, or whether they decide to move on to somewhere
Right.
else.
Right. In addition, I feel like, both of those issues are kind of the two ends of the line, right? You have the issues in the pipeline, and then you have the issues in the workforce. And both of them can be salary related, but I think also too, there is those issues with retention, and workplace culture and burnout, that all contribute, to whether, they stay within the workforce. Okay, great. So we have about 10 minutes left, and we know HRSA wanted to talk to everyone. So I just want to ask the audience if there's any other further questions before we move on. If so, put them in the Q&A. And if not, I don't see anything coming in. So if not, then we're going to turn it back over to HRSA to talk about the current NSSRN that is in the field right now.
Uh, So thank you again, everybody, for joining this webinar, and I will be providing a glimpse into the 2026 NSSRN, which, as we said, is currently underway. So the 2026 NSSRN officially began data collection in mid-March. Approximately 125,000 registered nurses were selected to participate in this nationally representative survey. Sample nurses received survey invitations and notifications through the mail. Data collection will continue into the summer. So we highly encourage everyone to raise awareness and encourage participation among colleagues and professional networks, particularly if you know somebody who is clinically working as a nurse. Broad participation is really essential to ensure that the quality and representativeness of the survey data accurately reflects today's nursing workforce. So the 2026 NSSRN builds on the important findings that Stephen had discussed earlier from the 2022 survey by expanding our understanding of key issues that's impacting the nursing workforce, such as travel nursing, job satisfaction, burnout, primary care, and workplace violence. I'm going to give you a sneak peek into some of these new items in relation to those key topic areas. So the 2022 NSSRN had identified substantial growth in travel nursing across the workforce, as we had discussed earlier. And given the increasing importance of this segment of the workforce, the 2026 survey includes additional questions focused on travel nurses. These new items will help us better understand who is working as a travel nurse and the characteristics of those positions, thus providing greater insight into workforce mobility and evolving employment patterns within the nursing workforce post-pandemic. Job satisfaction also remains a major workforce issue following findings from the 2022 survey, and the 2026 NSSRN expands questions related to job satisfaction to better understand factors influencing nurses' workplace experiences. These new items are intended to provide more detailed information about workplace conditions, professional fulfillment, and overall satisfaction. Understanding satisfaction levels is critical to addressing ongoing workforce challenges and strengthening the nursing workforce. Burnout also continues to be a significant concern across the nursing workforce. The 2026 survey includes enhanced questions to better measure burnout experiences among nurses. New items will provide more detailed information about the frequency and the severity of burnout. Additionally, the 2026 survey items on burnout allow for a deeper examination of contributing factors and workplace influences. The expanded measures will help identify patterns associated with stress, workload, and professional demands and provide a more comprehensive picture of nurse well-being than was previously available in previous survey cycles. The 2026 NSSRN includes items to improve our understanding of nurses' roles in primary care settings, and these findings will be particularly valuable for understanding how nurses help meet growing primary care needs nationwide. And last but not least, the 2026 NSSRN includes new questions to better understand nurses' experiences with workplace violence. Workplace violence has become an increasingly important issue for healthcare workers, and these items will capture information about the prevalence and nature of such incidents within the nursing workforce. Findings can inform decision-making and efforts to improve workplace safety and support healthier work environments and hopefully retention for nurses. So we appreciate everyone joining us again and your partnership in promoting survey participation and helping to ensure a robust representative data set for the NSSRN. And like we said before, if we welcome any questions and are happy to provide additional information following today's presentation, here's our information, and I'm sure our colleagues at HWTAC will be happy to disseminate our contact information to everyone. Thank you so much.
Thank you, Helen and Stephen and David. All great presentations. I think this is very informative and it's such an important survey. So we encourage anyone that is on this webinar today, if you're a nurse yourself or if you know of nurses in the field that you interact with, please encourage them to take that survey. If they receive it in the mail, they'll get a letter from the Census Bureau. So as Helen was saying, we can get as accurate a representation as we can as we go forward in planning our largest part of the health workforce, which is our nurses. Thank you, everyone, and have a good rest of your afternoon.